Hello, and welcome to this edition of Your Health, Your Wealth. I am Dr. Eddie Patton, your host, and I'm happy to be with you today and talk about healthcare and personal finance. And we'll dive into some considerations about healthcare costs and how to plan your healthcare costs, based on your own individual financial situation. We'll talk a little bit about healthcare costs throughout your lifespan, looking at expenditures, and also look at some things like financial toxicity and medical debt and how it relates to how we are managing our healthcare expenses with regards to our personal finance. So happy that you're here with me today, and let's get right to it. First thing I'll say is that when you are budgeting for your healthcare expenditures, there are a number of different things that you have to consider. First of all, your overall care. If you are a person who has a lot of chronic conditions like high blood pressure, diabetes, and so forth, your medical expenditures are going to be a lot more than if you don't have a lot of those chronic conditions. Same thing, your age and stage in life. If you're a 25, 30-year-old male, but you have 2 or 3 kids, well, they're under your health insurance. So you're going to have to think about things like the co-pays for every time that they have a runny nose and end up going to see their pediatrician and so forth. But the key to managing healthcare costs and your personal finance is to think ahead and make sure that as you're doing your budget and you're thinking about things like groceries, the mortgage, car insurance, all of these things that we budget for on a monthly basis, make sure that we are also budgeting and thinking about how healthcare is involved in our personal finances. So I'll start off by overall looking at some major things that have affected healthcare when it comes to personal finance. The Affordable Care Act, which was passed back in 2010, had 3 large arching goals. And probably 2 out of the 3 really, so I'll probably say 2 out of the 3 really had to do with personal finance. So the first one was to increase health insurance coverage. And as of the third quarter of 2023, some of the statistics that I've reviewed said that the uninsured rate still remains low at about 7.7%. Now, that's still a pretty reasonable, it's not as low as it should be, but that's still much lower than some of the uninsured rates that we've seen in the past. And as we'll talk about today, not having insurance can really lead to some catastrophic personal economic situations, particularly if something major were to happen to you. The second overarching goal of the Affordable Care Act was to expand Medicaid program. This has been a little bit slower because Medicaid is largely a state plan, and you have some states that have been more willing to expand Medicaid versus others who have been less willing to expand Medicaid. And the third is to support new models that make healthcare more affordable and lower costs. So if healthcare becomes more affordable and lower costs, you see less of this healthcare expenditures on a personal level, and this overall helps personal financing. So when we look at personal debt as it relates to healthcare, I don't think we really appreciate the amount of financial debt that people may have or go into because of healthcare. So there was a recent report that I read from the Consumer Financial Protection Bureau, came out in April of this year, 2024. And from this report, it said 15 million Americans have medical bills on their credit report. And this is similar to some other articles and reports that I've read from previous years, maybe even a little bit higher. But this amounts to about 49 billion in outstanding medical bills that are in collections. 49 billion. And this disproportionately affects people in the South, the southern part of the United States, and low income communities. Okay, 49 billion outstanding medical bills in collection, disproportionately affecting the South and low income communities. Now, the big three credit reporting agencies, talking about Equifax, Experian, and TransUnion, they have announced, different ways in which they hope to help with this issue when it comes to medical debt. One, they want to increase the time before reporting certain medical bills in collections from 180 days to a year. Stop reporting bills that have been in collections but were resolved, and then remove bills below $500. Now, this may not be important to a lot of people, especially if you are trying to use as little credit as possible. And I'm one of those who, try not to depend on a lot of credit and so forth. And certainly, when you read certain financial gurus, others will tell you, who cares about your credit score? If you have high enough income or you're in a high enough socioeconomic status, then who cares what your credit score is? And as a matter of fact, using debt or leverage is a strong economic tool, particularly if you are making investments. It's better to use someone else's money. So if banks would lend you the money to make a financial deal, an investment that allows you to repay the bank in a timely manner, you've made that investment, you recoup the benefits of that investment, you pay the bank back with their certain percentage. So that's the power of using leverage or lending as a goal when you're talking about investing. But to certain communities, and in order to be able to go to the bank and establish a line of credit and to get a large sum, a lot of this depends on your credit score. And it's a personal thing. So that's why this conversation about healthcare debt is so important. I also think that those populations mentioned earlier, the primary low income population, they have to depend on their credit score. They have to depend on this for certain necessities, even buying a car or that dream of one day owning a home instead of renting. These things are very important. So any little thing that can be done to try to reduce the economic debt from medical debt is important. Overall, though, the good news is that the report did find that the medical debt is declining, and the greatest decline is in the elderly population. So we are making some headway, but we do have some work that we still need to do to increase this conversation about personal financing and healthcare. So there was an article that was published in JAMA. It's called Medical Debt in the U.S. from 2009 to 2020 by Kluender et al. And it was published in 2021. And in this article, the mean amount of medical debt was found to be high and was greater among individuals again in the South and in the zip codes in the lowest income bracket. And over the last decade, medical debt has become the largest source of debt collections. I'll reemphasize that again. The last decade, medical debt, not other type of debt, credit card, everything else, has become the largest source of debt collections. Now, Medicaid expansion has been associated with reduction in medical debt collection, which is a good thing. And it goes back to what we were talking about initially as far as the goals of the Affordable Care Act, is that if we could positively affect these low-income communities by expanding Medicare and providing healthcare coverage, hopefully that will reduce some of the medical debt in these lower socioeconomic communities. And this article did point to that conclusion as far as the Medicaid expansion has been associated with some reduction in medical debt collections. So let's talk about a few things or strategies that we can do that can help us with our financial planning when it comes to healthcare. I mentioned to you earlier that you should understand where you are financially and understand from a healthcare standpoint your needs and necessities as an individual. How much are you paying per year in healthcare and plan accordingly for that? But along with that, it's always good to, number one, establish a rainy day fund. These are sometimes called emergency funds. I don't typically use the term emergency funds. I think I read recently in the psychology of money where, this whole terminology behind emergency fund as opposed to anything else, we're trying to somewhat go away from that and really just think of it as a way of putting money away for when something happened. For instance, if something were to happen and you did have to pay a deductible, like you had to go to the emergency room or were hospitalized for a few days, you would have a sum of money that is put away that you could get to easily to be able to take care of that particular fund. Or that particular bill. I like to call it a quick access pool or a quick access fund or a readily available fund. It should be put into a vehicle that you have quick access to, like a savings account or something like that you don't have to go through a lot of hoops to get the money out, like in some retirement accounts and so forth. So you should put this lump sum of money away in an account that you have easy, quick access to without penalty. Some economists will say you need to put away at least 2 or 3 months worth of expenses. And that includes all your expenses, including your mortgage or rent, your car insurance, everything else. And part of that you could use if something related to your healthcare comes up where you don't have to then go out and leverage debt in order to pay for that. You have this fund that you can do that. It can still be put into something that is earning interest, like a savings account. So if you don't use it, by the power of compounding and compound interest, you're still at least making something on that money that you're putting away. That's always a smart thing to do. I would caution against putting this sum of money underneath your mattress, because you're not earning any compound interest on it. And what if something happens, like your house burns down? Now you've lost this rainy day fund because of an emergency. There was a parable in one of the books I read. I don't know if it was 48 Laws of Power or which one, but it talks about this farmer, and he worked hard day in and day out, tilling the land, producing crops and selling them. And, he made all of this money, but he was so afraid of institutions and so forth that he had all of his money put into a big gold block and gold blocks. And then he hid them. He buried them. He buried these gold blocks on his property, somewhere where he didn't even tell his wife and kids. He was afraid they would take it as well. And then guess what? He died. So now his wife is struggling. His kids are struggling, all because he decided to put all of his money in a vehicle and wasn't transparent about it. And now it's hidden and no one is taken care of. So make sure when you're deciding on where to put this quick access pool or this quick access readily available fund that you put it into an account or somewhere where you have easy access and without the penalties that you would if it was like in some of these retirement accounts. So if you need money for copay, for health care, if you need money for deductibles or something like that, you can get it from this rainy day fund. And then you should try to replenish it as soon as possible. So if you take out $1,000 for deductible, well, try to put that back so that if you need that money the next year, it's there. So that's always a very good thing as far as financial planning, is to try to have these quick access accounts where you have money that you can use for something like healthcare. Another good thing to do is if you have the opportunity to take advantage of a flexible spending account or health savings account, FSA, these are always good. FSA is a special account that you can put money into that you can use to pay out-of-pocket expenses and healthcare expenses. Now, the important thing about a flexible spending account is that you don't pay taxes on this money. So what does that mean? So let's say that you make $50,000 a year and you want to put $4,000 into your flexible spending account. So you're only taxed on $46,000 a year. So it reduces your amount of taxable income. And this $4,000 you were going to spend on your healthcare anyway, but you're essentially saving that money that you normally would have paid for it in taxes, and you don't have to pay that. And now you can use this money that you put away for healthcare and use it for healthcare, and essentially get the free money of saving the taxes on that. These are usually offered through insurance plans through your job or employer base, usually limited to about $3,000 or $4,000 per person per enrollment period. So you can't put a huge amount in there. It can't be used to pay insurance premiums. Again, this is used for paying things like copay or deductibles. You can also use it for some covered prescriptions. You can use it for some over-the-counter medications, medical equipment like crutches or blood glucose checking strips. All of these things you can use your FSA account for. And it's a good way to do that. And the important thing is check with the company beforehand. Like, for instance, if you, like I use some of my flexible spending account for things like eyeglasses, frames. So you can always check with the company beforehand and say, hey, can I use my FSA account to pay for this and to cover for this? And again, you're paying money that you're paying that money anyway, because it's coming out of your check every other week or every month, however often you get paid. But you are saving it by saving on the with saving on the taxes for that money. Now, you usually have to use that money during the enrollment period, unless your employer gives you a grace period, usually a couple of months afterwards, or they may carry over a certain amount. So it does put somewhat of a pressure on you at the end of this enrollment period to go ahead and use those funds towards some type of healthcare expenditure. But again, it has to be a healthcare expenditure, and it can't be like some other type of thing like paying your light bill or credit card or anything else. So it's a good option if you have employer-based insurance and can really help out as far as helping with your personal financing. So now I want to go to the extreme end of this topic of personal financing and healthcare and talk about financial toxicity. This is a term that I've really recently been looking into a lot. It's mostly used in oncology due to the high cost of care for cancer. But we also see it in neurology, which is my field when you talk about strokes, central nervous system disease, and even back pain. Um, Cancer is number two to heart disease as the most expensive disease to treat. And drug costs are a considerable component of this financial toxicity. The whole point of bringing this up when it comes to talking about personal financing and healthcare is to really think through and understand your overall health and understand that certain diseases, they're just a higher cost to treating certain diseases than there are others. And a large part of this is due to prescription drug costs, but also within that is things like emergency room visits and ICU stays. For instance, I treat a condition that's called myasthenia gravis. And if this disease is well treated, then most people you can't even tell that they have it. But you can go through attacks, and these attacks can cause respiratory issues to the point where you have to be hospitalized and intubated. So now you've gone from just paying copays per month for your medication and doing well to now you're in the ICU at thousands of dollars per day. And if you haven't planned financially for that, once you are released from the hospital, and I've had patients who've been in the hospital for 30 to 60 days, that could be a big financial hit to you. So understanding that and making the right decisions and planning ahead of time so that you don't get yourself into this financially toxic situation is very important to your personal financing and understanding your overall health care. In summary, it's important to plan financially for your health care. And this plan is going to differ based on a number of different things. Number one, your age. Certainly, younger individuals have to plan differently than if you are older. The number of medications that we're on and the number of health conditions tends to increase as we age. So you have to take that into account. But even if you are a young, healthy individual, always make sure that you have planned if something were to happen. What does that mean? What do I have money put away to cover a deductible if I end up, unfortunately, in the hospital for something or anything like that? So we want to make sure and think through these issues as we are planning our overall financial situation and including our budgets for everyday life. The other thing you really want to take into consideration is your overall health. Do I have a number of chronic conditions that may exponentially increase my healthcare costs? And if so, you have to understand and to plan accordingly for that financially as well. And also understand your situation. If you are in a career where you are employed, self-employed, or business owner, picking those right plans, health insurance plans that may have those different types of incentives that may help you be able to plan financially and reduce the amount of healthcare costs that you have to pay in things like out-of-pocket expenses that you have to pay. So know your situation, including what's your deductibles and how much you're going to be paying for things like co-pays, doctor visits, and medications, and plan ahead for it. You should be able to look at your budget and say, okay, if my copay is $100 a month, and I get this medication filled every 3 months, so that's 4 times a year. So I need to plan for $400 a month, and you put that into whatever your different financial planning vehicle is. Outside of some badness happening, an accident or something like that, we should be able to take our healthcare expenditures and plan it and budget for them within our monthly budgets. That way, we're not hit with these quote unquote surprises. And if we do have something that happens within healthcare, like an accident or something where you end up in the emergency room or so forth, have a vehicle in place, a quick access fund or emergency fund, where you'll have funds to be able to take care of that and reduce the amount of medical debt from borrowing and so forth that unfortunately we're seeing when it comes to healthcare and personal expenses. So plan ahead and don't let healthcare be a financial burden on you or your family. We understand the situation that healthcare is in and the rising costs of healthcare. You got deductibles going up, co-pays going up, and so forth. But hopefully through this episode, I've been able to enlighten you into a couple of different tools, different things that you can do to try to plan ahead of time and help to reduce the financial burden of healthcare on your personal expenses. I thank you all for joining me today, and tune in for future episodes of Your Health, Your Wealth. If you'd like to learn more about what I do, visit my website, eddiepattonmd.com, and please consider sharing and subscribing to the show. Thank you.